Dr. Galia, the forum adopted the Beijing initiative to call for more global cooperation in fighting the pandemic. Why is more cooperation necessary at this point in time?
Between countries, there is the need for cooperation in such things as research. We have spoken at the conference of more than 10,000 papers that have been published, this large mobilization of scientists around the world, and also around WHO's research and development blueprint and trials on therapeutics and vaccines, such as the Solidarity trial that WHO is running. These are important areas. Advancing knowledge in one country helps all countries advance their knowledge as we share scientific achievements. And also, there needs to be cooperation in the area of aid. Some countries that have more resources, countries that have more need, there needs to be ways in which one ensures sustainable and equitable access to therapeutics, to protective equipment, personal protective equipment, to vaccines eventually when they complete their trials, and diagnostic kits in order to be able to identify and count the cases, as well as provide them with the right quarantine, isolation, and contact tracing, as well as the treatment that they need in order to limit mortality. So cooperation is a central word in all our response to a virus that is now spread all over the world.
In your work with China to promote global pandemic cooperation, what are your thoughts about China's contribution in this process?
So we have seen that since January, when the genome of the virus being shared globally, the growth of the knowledge of both public health and clinical guidelines that have been shared with other countries. And indeed, we've seen global cooperation in terms of both multilateral and bilateral cooperation. So there have been a number of important contributions that have to be recognized. Not least is the knowledge of how to handle individual outbreaks. In the more recent outbreaks, such as in Xinfa market in Beijing, we saw that the initial case was reported, the time between the initial and the last case in that epidemic was less than 1 month, without needing to have complete testing of everyone in the city, without closing the whole city. So there was, the knowledge is now accumulated of how to be more targeted in our responses to each new outbreak and how to achieve rapid control.
This fair features a public health sector. How do you think this will promote the safeguarding of public health in the global scale?
It's important to find ways, including through this conference, on how to recover better, how to build from the lessons of COVID into a more equitable world where innovation is not just innovation for the purpose of profit, but it is also innovation for the purpose of poverty alleviation.